Joining me now is Dr. Kartik Cherabuddi from Gainesville, Florida. He's an epidemiologist and associate professor of infectious disease at the University of Florida. Dr. Cherabuddi, thanks for being here. So Florida accounts for a fifth of all new COVID-19 cases in the nation, and yet 60% of all Floridians over the age of 12 are vaccinated. How might that discrepancy be explained?
And it's even more startling when you look at Florida has less than 7% of U.S. population, right? And we are contributing to a fifth of the cases. The good thing is most of our senior citizens are vaccinated, but a lot of the young aren't. I think that's where we are seeing spread because we don't have the social mandates and the restrictions we were self-imposing even. Those have gone out the door. So we are seeing these infections, and Delta is serving to accelerate them. It's just spreading the fire because Delta spreads much more easily between individuals. I think that's why we're seeing this.
Dr. Anthony Fauci talked about some leaders encouraging their constituents to get vaccinated, including your governor there in Florida. Let's play that for our viewers.
But I'm also gratified by seeing that even people who in the beginning were reluctant to promote vaccination are now doing it. I mean, people like Republicans, like Stephen Scalise, or even Governor DeSantis talking about getting people vaccinated. Asa Hutchinson out there beating the bushes, getting people to get vaccinated. I think that's what's happening now.
And while encouraging vaccinations, Governor DeSantis, as you heard in Mark Strassman's piece, has also aggressively moved to ban mandatory mask wearing. As a healthcare professional, do you feel that those are conflicting messages?
I think it makes me happy to see one part of it, as many other physicians as well, that we're coming out pro-vaccines. I think we need all three things now to fight off the Delta variant. We need to vaccinate, we need to do a better job at ventilating our homes and our institutions and so on, and then wear a mask because we have a huge surge. Vaccination is our most effective one, so embrace it. I'm glad other political leaders are embracing it. We need to ventilate more, and then the mask is going to be crucial while we face this surge of cases. We still have a huge amount of the population that's not vaccinated, and for their sake, I think we need to wear masks. Let it be a personal choice. I think slowly, just like we've seen people come around to promoting vaccinations, I think the leaders will come around to saying we need to mask at least for the short period. I'm hopeful they'll do that.
Well, as we previously mentioned, Florida just reported the state's highest cases for a single day of more than 21,000 cases on Friday. I'm wondering if you think that public schools and universities, you're obviously at the University of Florida, do you think that schools may have to rethink in-person education this fall? And how might the governor's opposition to masking play into the decisions of school leaders and parents?
The choices are tough. We really are discussing this as families across Florida, but also in institutions. I think institutions have a role to play. They've been leaders in many different initiatives for the state. I think many of the universities will come across, make it a safe place for the students to be. I think we'll see universities adopt these strategies and ask their students to use them. We have the tools, we just have to use them. And the universities, I think, will play a big role in this. I think we'll see our universities embrace them too.
Dr. Cherabuddi, we only have time to ask you one more question. And I want to get some context on what we've heard recently, which is infectious disease experts calling the Delta variant as contagious as chickenpox. Could you explain for us what exactly that means?
So when we saw the initial virus, right, the virus was spreading and it was fast enough, but it was similar to other respiratory infections, the flu, for example, and only in indoor spaces was it spreading more. Then we saw the alpha, which was spreading more than the regular virus. And now with the Delta, this is definitely the most infectious form we've seen of this virus. It can spread much more commonly. We are seeing this for people to understand it. In homes, when one unvaccinated person was turning positive, there were only about 20% of people in the home turning positive with prior strains. Now we're seeing 80 to 100% of people turn positive when one unvaccinated individual is positive. That's why people are comparing it to chickenpox. It's definitely much, much more infectious than the original strain was. We have to use all these strategies we have. I'm going to say it one more time. Go get the vaccine. Go get it now. Take your friends and family with you. Keep your windows or doors open if you're having people indoors, but stay outdoors as much as you can, even though it's hot in Florida. Stay in a covered outdoor area, and finally wear your mask. Just take it as personal responsibility to do it for your community and mask up.
If it's a personal choice, make the right one. All right. Dr. Kartik Cherabuddi, thank you so much for joining, and thank you for all that you do.
Thank you. Thank you for having me.